Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. And we are wrapping up our series on women's health. And today is going to be a topic that we've covered in the past to some degree, but it's going to be a little bit different. But it is all around the topic of adrenal health. So the adrenal glands are these little walnut-sized glands that sit on top of your kidneys. And we're going to talk about high and low cortisol because we often think about cortisol as a negative thing because it puts fat around our waistline or something like that. But you need it for a variety of reasons. But we're going to talk about various symptoms and problems that are associated with it. So we're just going to jump right into it because when we look at the adrenal glands, they're vital structures. They contribute to our overall health. There's an adrenal cortex, which produces what are called glucocorticoids, which are basically like your, stress hormones like cortisol. And it's a hormone that has, important effects on the heart, the metabolism, blood pressure, immunity, bone, nervous system, your ability to regulate your blood sugar. And cortisol levels vary in the blood throughout the day. They're generally high in the morning. They wake you up. And then they fall pretty rapidly as the day goes on. And if you work into the night, the reverse is the case. So cortisol production may be linked to, whatever your daily activity pattern is. But if you are staying up late at night, you are throwing off that normal rhythm with that. So both cortisol deficiency and its overproduction have a significant effect on the body. And we're going to be talking about both of them. So the first one. Low cortisol levels. Cortisol controls how much sugar and fat your body actually stores. It's one of its roles, and how much is released for fuel. Also, cortisol is regarded as your body's main stress hormone. So your adrenal glands release a burst of cortisol when you're stressed, and this is intended to help you cope with it. So your blood sugar levels are also increased for that boost of energy that you would need during that time. And low cortisol levels are a form of what are called adrenal insufficiency, or they're just not functioning at the level that they should, meaning that the adrenal glands are not producing enough cortisol, and this adrenal insufficiency can be broken down into three basic categories. Number one is going to be primary adrenal insufficiency, or what is known as Addison's disease. Super rare, but we need to talk about it because it's usually caused by an immune system malfunction that can launch an attack on the adrenal glands, impairing their cortisol-producing activity. This leads to low cortisol levels. This primary adrenal insufficiency can also be caused by cancerous cells, genetic disorders, surgical removal of the adrenal glands, and certain antifungal medications. Some symptoms associated with primary adrenal insufficiency or Addison's disease is weight loss, extreme fatigue, decreased appetite, depression, darkening of the skin, nausea. And then that leads us into secondary adrenal insufficiency. Now, this happens when the pituitary gland produces a low amount of what's called ACTH. And this is the hormone that triggers the adrenal gland to produce cortisol. And this leads to low cortisol levels. And some of the common symptoms would include things like hyperpigmentation of the skin, blood pressure issues, dehydration, and actually low blood sugar. And then that brings us to what's called tertiary adrenal insufficiency. Now, this is where there's a release of CRH, or corticotrophin releasing hormone, is actually inhibited. Now, this suppresses the ACTH levels that we talked about from secondary and leads to low cortisol levels. Now, this condition can occur after you stop using corticosteroids to treat chronic conditions. And that's why you need to consult your doctor if you're taking steroids or corticosteroids or, steroid injections, those kinds of things. And you need to be able to make changes to that schedule. Now, high cortisol levels, or essentially too much of it in the body, can cause what's called Cushing's disease. Again, super rare, and many of these factors include things like stress, pituitary tumors, and medications like steroids can also stimulate the development of this disease as well. But common symptoms of high cortisol levels, and you don't have to have Cushing's for this, are things like high blood pressure, because cortisol drives up your blood pressure. A round, flush face, changes in the skin, purple stretch marks and bruises, increased urination, weak muscles or weakened muscles, osteoporosis, mood swings, depression, anxiety, and irritability. So if you notice any of these symptoms associated with low cortisol levels or high cortisol levels, it's important to see your doctor for a particular test. Now, what's the best way to address or to test adrenal hormones? Oftentimes, they're gonna use a blood test, which I think is totally fine, but not that accurate or not accurate for certain things. You're gonna need a saliva test at least done over a 24-hour period where you're gonna collect most likely between 4 and 6 samples of saliva so they can test your adrenal hormones or at least cortisol over that period of time. So, hope this helped you. It's Dr. Jason Jones signing out. We're wrapping up this series on women's health. Hope you got something out of it. If you have any questions regarding any of that, feel free to go to our Facebook page, drop those questions in there, shoot me a private message, and I'll be happy to help you out with them. Y'all have a good day. See you later. Bye-bye.